My name is Victoria Candia and my presentation is on aphasia. So first I have a short introduction video that just is like quick 1-minute introduction on what aphasia is.
Aphasia is an acquired communication disorder. Acquired means that you're not born with aphasia. It's something that happens to people after a stroke, brain injury, or a neurological disorder called primary progressive aphasia. Aphasia impairs a person's ability to process language, but it doesn't affect their intelligence. People with aphasia are still just as smart, though they may have problems understanding language, speaking, reading, or writing. So how do you communicate with someone who has aphasia? First, be patient. Allow plenty of time for a response. Make sure you're speaking with and not for the person. Use simple, short sentences, and make sure you go to a quiet place to speak so there aren't a lot of distractions. People with aphasia may need to use communication tools such as an iPad or drawing with a pen and paper to get their point across. They may also use gestures or pantomime if they can't come up with a word. Next time you meet someone with aphasia, you'll remember that there's plenty you can do to be supportive and spread awareness. In fact, help us out and pass this video along. We all could use more understanding in this world. Thank you.
So that was a quick introduction on it. So what is aphasia? It's a disorder that results from damage to portions of the brain that are responsible for a language. And aphasia usually occurs suddenly, often following a stroke or head injury, but it can also develop slowly or develop fast. And as a result of a brain tumor or progressive neurological disease, that's some of the reasons people get aphasia. And disorder impairs the expression and understanding of language as well as reading and writing, but as the video states, it doesn't affect their intellectual needs. It would only affect expression and understanding, so mainly just communication. And there's two kinds of aphasia. There's non-fluent, and non-fluent takes extra effort to speak, long pauses in between words, grammar is impaired, language comprehension relatively is intact. And there's Broca's aphasia, which is repetition of words or phrases. Then there's transcordial motor aphasia, strong repetition skills that may have difficulty spontaneously answering questions, which is a part of the language comprehension relatively intact, which goes with non-fluent aphasia. And then there's when the language comprehension is impaired with non-fluent aphasia, results in global aphasia, which is severe expression and receptive language impairment. May be able to communicate using facial expressions, annotation, and gestures, but communication will be severely impaired. And then there's fluent aphasia, which is the person is able to produce connected speech, sentence structure is relatively intact but lacks meaning. So this is a less impactful aphasia because they can still communicate without just doing gestures. Like they can still communicate, just gonna take a little bit more effort. And sentence structure is gonna be relatively intact but lacks meaning. And there's language comprehension is intact with aphasia, is when there's conduction aphasia or anomic. Conduction is when there's word finding difficulties or difficulty repeating phrases. So if you stare at a cup, you can't think that it's a cup, so just random words are going to come out. Or there's anomic aphasia, which is a repetition of words or phrases, and word finding difficulties as well. And when language comprehension is completely impaired with fluent aphasia, there's Wernicke's aphasia, which is a repetition of words or phrases poorly understood. So you're going to repeat words or sounds and phrases, but you're not going to be able to communicate that well. And there's transcordial sensory aphasia, which is repetition of words or phrases good, but may repeat questions rather than answering them. So just for comprehension reasons, they're going to repeat the questions a bunch of times instead of communicating with you the answer to the question you asked. And 0.36% of people in the United States have aphasia, which is 1 in every 275 adults suffer through aphasia. And some of the main things, again, that can cause aphasia is stroke, head injury, brain tumor, infection, dementia sometimes. And common symptoms of aphasia, so you can tell. A lot of the symptoms you're going to want to look for if they do have dementia, they suffered a traumatic brain injury, and they seem to not be recovering, and you see these symptoms, which is trouble speaking clearly, trouble understanding their speech, or words come out that are funny, like they stare at a cup and they'll say banana, like weird words or like sounds will come out instead of words, or you can tell that they're trying to pronounce a word. It looks like when they're trying to say horse, because like they can't get the word out because their brain's not connecting. Trouble writing clearly is also a symptom. Trouble understanding written words can also be a symptom. Trouble remembering words and trouble remembering object names, like I said, like cup. They can stare at a cup, the word cup does not come to mind. Or it could come to mind, but it's not going to connect out in speech. And how can a speech pathologist assess this? Individuals identified with aphasia through screening are referred to an SLP for comprehensive assessment of learning and communication, the impact of communication impairments on quality of life, so they can just tell how much it's affected their life, what tools they can use to make their life more accessible. They can tell the functioning limitations relative to the individual's premorbid social roles and impact on his or her community. So overall, an SLP can affect how much the aphasia has affected their speech, how much can be repaired, how much can be worked through, in overall ways that they can, people around them, in ways that they themselves can better use aphasia as like a tool, not like yes, it's a disability, and a lot of times it's not going to be curable, but SLPs can help assess how much has been affected with speech and what tools they can use themselves to better communicate and people around them to better understand that you gotta work with them, like the video said. You can't like answer for them, but with them. And some complications that can come with aphasia, numerous quality of life problems like jobs, relationships, day-to-day functions, overall quality of life can be impaired. And language barriers due to aphasia can lead to embarrassment, depression, a lot of mental health problems. And anyone can get a brain injury and get aphasia. So students with academics and accommodations, it's going to be pretty big accommodations for school, a lot of times resulting in school having to be taken through a different route, like online school or tutoring. But for academics and accommodations, they're going to have difficulty communicating, obviously, but they don't lose intelligence, which is important to note. The use of iPads or other technology can help make the classroom more accessible and easier for people with aphasia. It's important for teachers and people just in their life in general to remember patience is really needed when they speak. So when we seem frustrated and they're trying to talk, imagine how frustrated they are when they can't get the word out. So before you yourself get frustrated because they're taking too long to speak, think about how frustrated they are not being able to speak themselves. Again, do not speak for them, but with them, so help them out a little bit, but don't answer for them. But if you can hear them trying to pronounce a word and you know the word, you can help them out a little bit or help them find the word. And you can allow alternate verbal assignments to people still in school. And you can try to understand the disease in order to help the person, which is a big one. So once you can understand that it's going to take patience, they're working through it, what kind of aphasia they have. Is it repetition? Is it that they're going to repeat the question to you? Is it sounds? Is it words? Is it fluent, influent? Knowing their disease in general and getting more in depth in research can really help them also. And that is my presentation on aphasia.